Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Renal stones are crystals in the urine. Urinary crystals. You can do microscopy for examination of urinary crystals. If the crystals are bipyramidal shaped or enveloped shaped, then it can be due to calcium oxalate dihydrate. If the urinary crystals are dumbbell shaped crystals, then it can be due to calcium oxalate monohydrate. If you see prism shaped or star shaped crystals, then it can be due to calcium phosphates. If you see the presence of coffin lid crystals, then it is seen in triphosphate stones or struvite stones. If you see hexagonal crystals are seen in cysteine stones. Rhomboid crystals or yellowish tinge crystals are seen in uric acid stones. So if you see, these are actually bipyramidal shaped or envelope shaped crystals which are seen in calcium oxalate dihydrate. These are see this one. This is an envelope shaped crystal which is actually calcium oxalate dihydrate. Even this is an envelope shaped crystal which is seen in calcium oxalate dihydrate. Then, in calcium oxalate monohydrate, we see dumbbell shaped crystals. So, these are the dumbbell shaped crystals in calcium oxalate monohydrate. Calcium phosphate. In calcium phosphate, we see the prism shaped or star shaped crystals are seen in calcium phosphate. Coffin lid crystals are seen. These coffin lid crystals are a triple phosphate crystals and they are seen in struvite stones. In struvite stones, we see the coffin lid crystals. Hexagonal crystals. These hexagonal crystals are mainly seen in cysteine stones. In cysteine stones, we see hexagonal crystals. Rhomboid shaped crystals are yellowish tinge crystals. These rhomboid shaped crystals or yellowish tinge crystals are seen in uric acid stones. So these are the different types of crystals which are seen.
Thank you and thank you for watching.